Complete bed bath. So for the purpose, we have first remove accumulated oil, perspiration, dead skin cells, and some bacteria. And then stimulates circulations, and then produces a sense of well-being. And then lastly, offers opportunity for the assessment. So for the preparation, assessment, assess for the condition of the skin, physical or emotional factors, presence of pain and need for adjunctive, and then range of motion of the joints, any other aspect of health that might affect the client's bathing process, and then need for use of a clean gloves during a bath, and then determine the purpose of type of bot the client needs, self-care ability of the client, and then any movement or positioning precautions specific to the client. And then other care to the client might be receiving. And then the client's comfort level with being bought by someone else. And then necessary bath equipment and the linens. So for the planning, assemble the equipment. We have basin or sink with warm water, and then soap dish, and then linens, bath blanket, two towels, wash clothes, and then clean gown, pajamas, or clothes as needed, and additional bed linen and towels if required. And then glove if appropriate, and then personal hygiene articles, and then shaving equipment, and then table for bathing equipment and laundry hamper. So for the implementation, for the procedure, so introduce yourself to your client and then verify to your client's identity and explain to your client what you're going to do and why it is necessary and how the client can cooperate. So, hello po ma'am. I'm your nurse Arlene for today from Tarlac State University College of Nursing. May I know your name po? Patingin po ng listag. Um, Ilan taon na po kayo ma'am? Kailan po yung birthday nyo? Kamusta po kayo? And then after that, perform a hand hygiene and observe other appropriate infection control procedures. And then after that, provide for the client privacy and drawing a curtains or closing the door to the room. So, and then after that, prepare the client and the environment. And then after that, invite a family member or a significant other to participate if desired. And then close the doors and windows to ensure the room it is comfortable, the temperature. And then offer the client bedpan or urinal or ask whether client wishes to use the toilet or the commode. Ma'am, gusto niyo po ba mag-bedpan po kayo or kayo na po mismo ang pumunta sa CR pag-visit po kayo? Sige po. And then after that, encourage the client to perform as much personal self-care as possible. And then during the bath, assess each area of the skincare. Lang po natin. And then after that is Prepare the bed and position the client appropriately. And then after that, position the bed at a working height and lower the side rail on the side and close to you and keep the other side rail up. Assist the client to move to near you. So po kayo dito sa akin, ma'am. And then after that is place a bath blanket over the top sheet and then remove the top sheet from the under the bath and then blanket starting at the client's shoulder and moving the linen down towards the client feet and ask the client to grasp and hold the top of the butt and uh, the butt blanket while pulling the linen to the foot of the bed. And then note if the bed linen is to reuse, place it over the bedside chair. If it is to be changed, place in the linen. Ang pahawak ko ito na. And then after that is so remove the client's gown while keeping the client covered with the bath blanket. Place the gown in the linen hamper. Ang pahawak. And then after that is make a bath mitt with the wash cloth and then wash the face of the client or the patient. And then place towel under the client head. And then after that is wash the client eyes with water only and then dry them well and use a separate corner of the wash cloth for each eye and wipe from inner to the outer canvas. And then after that is ask whether the client want to use soap on her face. Ma'am, gusto niyo po ba na lagyan po natin ng sabon ito? Sige po. And then after that, wash and rinse and dry the client face and ears and the neck. Ma'am, tapusin lang po natin. And then use a dry towel to wipe the wet face and the ears and neck. And then after that is remove the towel from the under the client's head. And then after that is wash the arms and the hands. And then place a towel lengthwise under the arm, farther away from you. And then after that is wash and rinse and dry the arm by elevating the client's arm and supporting the client's wrist and elbow. First is wash the axilla of the patient. And then after that, wait for a minute and then use a towel to dry the arm. And then after that is apply deodorant or if powder if the client decide. Ma'am, gusto niyo po ba lagyan po natin ng deodorant? Ganun po. Ng Rexona yung ano niyo po? Yung article niyo. Sa next ano na po tayo? And then after that, repeat the procedure into the client arm. Ang patingin po yung axilla po niyo. Unahin po natin yung axilla. Okay po ma'am. And then after that, use a towel to dry the right arm of the patient. And then after that, place a towel on the bed and put a washable on it. And place the client hand in the basin and assist the client as needed to wash and rinse and dry hand, paying in particular attention to the spaces between the fingers. And we've done with that. And then after that, repeat for the hand and arm near you and exercising devotion if an IV infusion is present, checking flow after moving the arm. We've done with that also. And then wash the chest and the abdomen of the patient. And then place a bath towel lengthwise over the chest. And then fold the bath blanket down to the client pubic areas. And then after that is lift the bath towel off the chest and the bath chest and abdomen with your mitted hand using a long, firm stroke and rinse and dry well. And then after that, replace the bath blanket when the areas have been dry. And then use a towel to expose the legs farther from you by folding the bath blanket and then towards to the other leg and being careful to keep the perineum covered of the patient. And then after that is lift the leg of the patient and then place the bath towel lengthwise under it and then wash and rinse and dry the leg using the long, smooth, and firm stroke and from the ankle to the thigh or knee to thigh of the patient. So, start from the proximal to distal. And then after that is uh, reverse the coverings and repeat the for the other uh, feet of the patient. And after that, dry the using a dry towel, wipe the wet of the patient legs and feet. And then cover it. And do the procedure into the other legs of the patient. Expose the right legs of the patient.
So, from proximal to distal. And then after that is uh, use a wash the feet of the patient through the use of the basin with water. And before anything else, so use a dry towel to wipe the um, right legs of the patient rather. And then after that, we have here basin with water. Mhm. Diba yun po? And then use a dry towel to wipe the wet. And then after that is dry each foot. And I've already done with that. And then obtain fresh warm bath water or when necessary.
Assist the client into a prone or sideline position facing away from you, and then place the bath towel lengthwise alongside the back and the buttocks while keeping the client covered with the bath blanket as much as possible. Ma'am, ang sideline po kayo, ma'am. Tapos mo yung ano. Tapos mo yung And then after that, wash and dry the client's back, moving from the shoulders to the buttocks and upper thighs, paying attention to the gluteal folds. And then after that, use a dry towel to wipe the wet on the cranial of the patient and the back of the patient. And then after that is perform a back massage now or after the completion of the bath. Ma'am, gusto niyo po ba magpa-massage? Ganun. And then after that is assist the client to supine position and determine whether the client can wash the perineal area independently if the client cannot and do so and read the client and wash the area. Ma'am, kaya niyo po bang hugasan yung perineal ninyo ng mag-isa? Sige po, ma'am. So, balik na po tayo sa supine position. Po. And then after that, assist the client with the grooming aids such as powder, lotion, or the deodorant. Ma'am, gusto niyo po bang maglagay ng powder, ng lotion, at saka po deodorant? Sige po, ma'am. And then after that is document the type of the given bath, skin assessment such as excrocation, erythema, the exudates, rashes, drainage, or skin breakdown, and then nursing intervention related to the skin integrity, and then ability of the client to assist or cooperate with botting, and then client response to the botting, and then educational needs regarding hygiene information or teaching shared with the clients or their family. So for the evaluation of the client's tolerance of the procedure, and then conduct appropriate follow-ups such as determining condition and integrity of the skin, and then client strength, the percentage of the bath done without resistance, and then relate the prior assessment data if available. And then after that, perform a hand hygiene. Remove the gloves, and then alcohol to remove all the microorganisms. And then after that is note the client record. So ma'am, okay naman po yung mga pakiramdam niyo ma'am. Thank you po ma'am.